My definition of street medicine is giving health care to those who are living on the streets, but the health care incorporates so much more. When you're delivering health care, you're delivering the kind of care that we call holistic. It means we're caring for and about the person. It means we're looking at how can we coordinate care for that person over and above the immediate physical needs. When I lived in Seattle, I heard a PS about needing more volunteers to serve dinner to homeless people on Christmas Day. So my family and I went down. I just thought it was a very moving experience, and I was intrigued by so many homeless people who were so appreciative of what we were doing. And then when my daughter and I moved to Salt Lake, and I started to get involved with the Salvation Army, and then I was at Intermountain Healthcare as a vice president, and we started reaching out. We were creating clinics for the uninsured. We participated in the 4th Street Clinic for homeless people. And as I got more involved in the community, I kept on asking myself, first of all, why are some of the things that are happening being allowed to happen? And why not in terms of, is there anything we can or can't do? And I don't like being told we can't do something. I like our mantra, which is, those of you who say it can't be done should get out of the way of those of us who not only say it can be done, but are actually doing it. Because I was involved in helping to start homeless outreach here in Salt Lake, I was asked to speak about the history and the collaborative efforts that we have going on, because we know there are collaborative efforts going on around the country, but we also feel that we've taken the next steps in getting people as part of the team. For instance, I tell some of the leadership in our legislature that they're part of my team, they're part of the homeless outreach team, because they've allocated money and we let them know what the return on their investment is. The leadership in the legislators, the President of the Senate, the Speaker of the House, the majority leaders, and many of the other legislators, they're all part of our team because they have participated by allocating money. And sometimes they say, love to do what you're doing out there, Pamela. I just don't seem to have the time. And I remind them that everybody is unique and everybody has unique abilities, and we all serve in a very different kind of way. And their way is to help fund us so we can do the work right out on the streets with the street medicine and the homeless outreach. I'm hoping that after hearing me speak, that the participants will say, perhaps there are some sources of funding for our programs that we haven't looked at. Have we thought about these young entrepreneurs who are looking for places to invest their money and looking for a return on investment? And I'm hoping people will realize that we need to tell our story more. We need to educate people more. And I feel very strongly that if we tell our story with passion, then people respond with compassion.